Are you prepared to take control of your COPD before it takes control of you? Managing COPD isn't just about medications. It's about knowing your triggers. It's about knowing your how to manage your lifestyle and how to recognize the symptoms and signs of your COPD. Hi, my name is Erika Thomas, and today we're going to discuss how to manage your COPD. First, we're going to talk about how to manage your medication and your overall health. If you have COPD, it's important that you discuss with your physician your zones. When I say zones, I'm talking about when is it time to go to the hospital, or when is it time to increase your medication dose, or are you just having a good day? The green zone is you're breathing fine, you can go about with your normal daily activities. Your yellow zone is when you may be a little bit more short of breath. So you may normally take your medications as needed, but now you are taking your medications about every 4 hours. The red zone is when your medications are no longer working. You have went from as needed to Q4 to needing your medications about every hour. This is time when you should call 911 or go to your nearest emergency room immediately. Monitoring and managing symptoms. Know your triggers. Is dust one of your triggers, or smoke? You should try to avoid those at all times if so. It's important to recognize early signs of flare ups and how to respond. It's important to go to your regular checkups with your physician. It's important to keep a diary to track your flare ups and triggers and your changes in your condition. Lifestyle changes for COPD management. Number one, the most crucial step is to stop smoking. I know that you have been told this several times and you are tired of hearing it, but number one is you need to stop smoking. Number two, diet and nutrition. Maintaining a healthy weight and diet is very important to support your lungs. Number three, exercise and pulmonary rehab. Benefits of moderate exercise is very important for COPD. Number four, breathing techniques. Pursed lip breathing is a very important tool to learn how to do when you have COPD. Pursed lip breathing is going to help you get in the air you need when you are short of breath or just feel like you are suffocating. So, pursed lip breathing is very important to know, and you should discuss with your doctor on how to do those pursed lip breathing. So, pursed lip breathing is very important when having COPD because sometimes you just feel like you're about to suffocate if you've had a flare up. But the way you do it is you're gonna sit up straight, you're gonna purse your lips, breathe in, and let it out. This is going to not only help you get the flow into your lungs, but it's going to help you to relax. Most people who have COPD, when you can't breathe, you panic. So, pursed lip breathing is going to help you manage the flow of your breathing, but also take away some of the anxiety that you are having from not being able to breathe. The last thing to manage your COPD is to get support. Coping with the emotional challenge of COPD can lead to anxiety and depression. Most communities have support groups, better breathing groups to help you be around people who are suffering from the same type of disease, involving family and friends in your care so they understand what is going on with your diagnosis and how they can help you to manage your COPD. Oxygen therapy. I know that having to use oxygen can be very difficult for some people, but just know that oxygen is just like any other drug. So if you need it, there's different times you may need it. You may not need to use it every day. It may just be as needed. But it's important to use your oxygen if you need it. Hire a home care agency that specializes in managing patients who suffer from COPD. And we are that home care agency who is specialized to manage patients who have COPD, because me myself am a respiratory therapist. As a respiratory therapist, I am able to train my caregivers on how to recognize when our patients may be having signs and symptoms of COPD flare-ups, and they are trained on how to make sure that their clients are taking their medications when they are supposed to, and following their doctor's guidelines in managing their COPD. For more information on our services, you can reach us at www.lillieshelpers.com.